What if some of the memory loss being blamed on aging isn't aging at all? What if it's sitting in a medicine cabinet in a bottle most people trust completely? That's the uncomfortable possibility researchers keep circling back to. Not poison, not negligence, just ordinary, everyday medication taken exactly as prescribed. Most people assume dementia builds slowly, silently, with no clear trigger. But there's a quieter pattern hiding inside that assumption. Some cognitive decline doesn't creep in over decades. It accelerates fast after certain medications enter the picture. And here's the part almost nobody questions. The drug gets blamed last, if it gets blamed at all. Doctors have a name for this blind spot. It's called anticholinergic burden, and it sounds harmless until you understand what it does. These medications block a brain chemical called acetylcholine, the same chemical your brain uses for memory and learning. Block it long enough and the brain starts behaving like it's aging years ahead of schedule. But here's where it gets interesting. The medication causing this might be sitting on a pharmacy shelf, no prescription required, diphenhydramine. Most people know it by its brand name, the sleep aid and allergy pill taken almost without thought. It's anticholinergic at its core. Used occasionally, the risk stays low. But here's the twist almost nobody hears about. Long-term, frequent use has been linked in multiple studies to a higher risk of cognitive decline, especially in older adults. Not because it's poison, because it quietly interferes with the exact chemical memory depends on, and this pattern doesn't stop there. Bladder control medications, the kind prescribed for overactive bladder, work the same way. They block acetylcholine too. Which means a medication meant to fix one problem can be quietly working against an entirely different system, one tied directly to thinking and memory. Most patients are never told the two are connected. Now here's where the story shifts into something even less talked about, benzodiazepines. The anxiety and sleep medications, the ones with names ending in PAM or LAM, they calm the nervous system fast, which is exactly why they're so widely prescribed. But here's what most people don't realize. Long-term use has been associated with increased dementia risk in several large studies. The mechanism isn't fully settled, but the pattern keeps appearing, study after study, country after country. But the real twist is what happens when you stop looking at single drugs and start looking at categories. Sleep medications built to mimic benzodiazepines, sometimes called Z drugs, carry a similar shadow. They're marketed as gentler, safer alternatives. Yet research has linked long-term use to increased confusion, falls, and in some studies, accelerated cognitive decline in older adults. The branding changed, the underlying risk pattern didn't disappear with it. Here's where the deepening loop gets sharper. Certain older antidepressants, the tricyclic class, carry strong anticholinergic effects too. They were designed decades ago, before this connection was even understood. And this is the layer most people miss completely. A medication prescribed for mood can quietly stack onto a sleep aid taken for insomnia and a bladder medication taken for incontinence. None of them dangerous alone, but together they compound. Doctors call this cumulative anticholinergic load, and it's rarely tracked across multiple prescriptions written by different specialists who never speak to each other. Antipsychotic medications add another layer to this picture, especially in older adults. They're sometimes prescribed off-label for agitation or sleep issues unrelated to their original purpose. But here's the uncomfortable detail regulatory agencies have flagged in elderly patients. Certain antipsychotics carry warnings about increased risks, including accelerated cognitive and physical decline. The warning exists. The off-label prescribing, in many cases, continues anyway. Opioid pain medications enter this story differently, but the destination looks similar. They sedate, they slow brain activity, and with long-term use, especially in higher doses, research has linked them to measurable cognitive changes. Reduced activity accelerating decline that then gets misread as inevitable aging, when part of it might have been preventable or even reversible with the right medical guidance. And that reversible part matters more than almost anything else in this story. Some of this cognitive fog isn't permanent dementia at all. It's sometimes a temporary, drug-induced impairment that can improve once a doctor carefully adjusts or removes the medication causing it. The tragedy isn't the medication existing. It's how often that possibility never even gets investigated. This changes how the entire conversation should be framed. Not as a list of medications to fear, but as a pattern worth questioning, especially for anyone managing multiple prescriptions over many years. The shift isn't paranoia, it's awareness, the kind that turns a passive patient into someone who actually asks why a medication is still being taken and whether something safer now exists. Some of it temporary, some of it lingering longer than expected. The question researchers keep asking is uncomfortable. How much of what gets labeled as dementia in older patients on chronic pain management is actually something else entirely, something potentially tied to the medication itself? And then there's a category that surprised even researchers. Proton pump inhibitors, the heartburn and acid reflux medications taken by millions every single day. Some studies found a possible association with increased dementia risk over years of continuous use. But here's the part that matters just as much. Other large studies found no significant connection at all. The science is genuinely divided here, not settled, which makes this one of the most debated medication-cognition links in modern research. Long-term corticosteroid use closes out this pattern, and it deserves its own moment of attention. These are powerful anti-inflammatory medications, essential for many serious conditions. But sustained use has been linked to changes in brain structure, particularly in regions tied to memory. The drug isn't the villain here. The dose, the duration, and the lack of monitoring often are. So here's the framework forming underneath all 9 of these patterns. It's rarely one medication acting alone. It's accumulation, across categories, across years, often across doctors who never see the full prescription list. Anticholinergic load stacking with sedation. Sedation stacking with reduced activity.